welcome to the Live Well Show. My name is Hannah Woods, and I'm the Service Line Community Outreach Coordinator here at Tanner Health, which is a big fancy title that just means I'm in charge of all things patient education and community outreach opportunities. So one of the new things we're starting is this podcast where we're going to get into all things healthcare and helping you live well. So today I'm sitting here with Dr. Schuyler Cook, DO from West Georgia Internal Medicine. So Dr. Cook, why don't you start out by telling us a little bit about yourself?
Sure. So as you said, I am an osteopathic physician. I am the first physician in my family, actually. Cool. Now there's a second one because my younger sister graduated from medical school recently. But my whole family lives in Indiana, except for me. And we grew up in a very rural area. So I knew that when I wanted to be a physician, that I wanted to come back to a more rural community and serve there because that was such a big part of me growing up in that sense of community. And now I'm at West Georgia Internal Medicine. I've been there since 2021, which is also when I finished residency. And I'm board certified in internal medicine.
So what I was really excited to sit down and talk to you about today is GLP-1s. That's something right now that is a buzzword. Everybody hears about GLP-1. I think a lot of people have misconceptions about GLP-1s. Mm-hmm. They don't know a lot about GLP-1s, but they're so widely talked about right now. So I wanted to talk with you about what is a GLP-1, what are they used for, and let's get into it. So first and foremost, so GLP-1, for those of you who don't know, stands for glucagon-like peptide 1 receptor agonist.
Yes. So correct. A lot of times you'll also see people refer to them as GLP-1As.
Okay.
So you may see that from time to time. Honestly, to me, it's an interchangeable.
Okay, perfect. So can you tell us, what does that mean? What is a GLP-1 at its core?
Sure. So it is a peptide that binds to receptors in your body that stimulate quite a few different things to happen. So one of them is slow down digestion. So it'll signal your stomach, hey, let's slow down a little bit, which helps aid in you feeling fuller faster, but it also helps that when it binds that receptor that you feel more satiated.
Okay.
So you feel fuller quicker, if you will. Mm-hmm. So it helps on the satiated part. It helps cut down food noise. Mm-hmm. I hear that one frequently. Mm-hmm. We get weight loss with it, but the coolest thing, in my opinion, because I treat a lot of diabetes, is that this is the first medicine that we've found that stimulates beta islet cell production in the pancreas. And I can explain that more. I just saw the deer in the headlights look. So the beta islet cells in your pancreas are the ones that are responsible for making insulin, which is what manages your blood sugar.
Yes.
So historically, before these medicines, after about the age of 30, you don't make any more beta islet cells. And what you have is what you're stuck with.
Okay.
At least that was the thought. Whereas these medicines stimulate that beta islet cell growth. So those of us that are over the age of 30, we can get those cells back, and it can bridge that gap as far as needing more insulin to match the blood sugar.
Okay. And so now, correct me if I'm wrong, but GLP-1 is actually something that is produced naturally in the body, correct?
It is. It is just small amounts.
Small amounts. And so this is something that people who experience a hard time with losing weight for whatever reason, is it true that they don't produce as much of that hormone as someone who maybe has an easier time with losing weight, or maybe, I don't know if it's tied to metabolism?
Sure. The vast majority of it is tied to metabolism. Okay. We have not studied the amount of GLP-1 as much to compare various groups of people. So that is certainly one area we could look into as far as medical research goes. But it's mostly to do with metabolism.
Okay. Gotcha. Okay. Well, so I know you're talking about diabetes is, something that it obviously GLP-1s treat, and they were originally created to treat diabetes. Is that correct?
Yes.
As well?
Yeah. The first ones were Trulicity and Victoza.
Okay. And now, were those true GLP-1s? I know there's also semaglutides and liraglutides. What's the difference in that? I've heard less about liraglutides, but I think a lot of people hear semaglutide and just use them interchangeably with GLP-1 or tirzepatide.
Yes.
What's the difference with those?
Sure. So when we're looking at liraglutide versus semaglutide versus tirzepatide, those are just 3 different members of the GLP-1A class.
Okay.
So semaglutide may be more familiar to people known as Ozempic or Wegovy. It's also Rybelsus, which is the only pill form that we use for diabetic patients,
Okay.
not weight loss.
Okay.
But then liraglutide is Trulicity and Saxenda, and then tirzepatide is Mounjaro and Zepbound.
Okay.
So they are slightly different,
Okay.
but in my practice, I have not seen a huge difference between each one of them.
Each medication. Okay. Gotcha. Okay. Well, so then tell me this too, because I know you just went through the list of the names of all those individuals, but I also know there are companies out there that are what I would call third party.
Yes,
that
there are.
Advertise GLP-1 medications, whether it is a shot, whether it is a pill. What about those? What's your perspective on those? Do you see a lot of people that come in asking you, can I take this? Especially when it comes to, I know insurance doesn't always cover a GLP-1 for certain patients. So
cost is definitely the biggest barrier for a lot of patients with GLP-1s. And so these third-party companies that are compounding or making their own GLP-1As can be a more affordable option. However, I'll tell you exactly what I tell all my patients. Those aren't necessarily being tested, and they're definitely not regulated.
Yeah.
So it's hard to tell if you're getting what you're paying for. So that is my only hesitation with those. Anytime my patient brings that to me and says, hey, is this an option? So
yeah, that's a good answer though. Because I know when I see things like that, even if I'm not necessarily looking for myself, just, you see commercials, you hear people talk about it. I always get skeptical. But I think just like with anything, talking to your primary care provider, your doctor,
that's that's the best thing
way to go. So I think that it's important to be able to hear your perspective on those third party companies that are offering GLP-1. But I think a lot of times when people are talking about GLP-1s, a lot of people think about what I would call vanity weight loss. So just losing weight so that they feel skinny, so they feel better about themselves, which, if that is what you're trying to accomplish, I know there's a lot of people that do take it for that. But I think there's a lot of other uses to GLP-1s that people are not as familiar with.
Oh, absolutely.
So, and I know you're very passionate about some of these other treatments and uses for GLP-1. So let's talk a little bit about high blood pressure and GLP-1 usage. So full disclosure, I'm your patient, and I am a 24-year-old woman with way too high blood pressure. And so we tried all the things before putting me on a GLP-1, and that came down to where that was the best treatment option for me. And so I have been on the medication myself and seen incredible effects with my blood pressure. So let's talk a little bit about that and cardiovascular health. How does this medication treat those issues in people of all ages?
Sure. So one of the things it does is it, again, affects your metabolism. So in a way, to boil it down, it does improve your metabolism in a patient such as yourself. So that can definitely assist with weight loss, which is absolutely a huge thing for cardiovascular health. It's also important for pulmonary health, for kidney health. It's important for quite a few different things. But when we're talking about cardiovascular risk, high blood pressure and high cholesterol are associated with higher weight. There's no question there.
Yeah.
And so a lot of times if we lose the weight, those improve, and that reduces our risk of heart attack and stroke dramatically.
Absolutely. Absolutely. And what about folks who experience maybe their high blood pressure, maybe partially because of weight, but also, there's the genetic side of things. I know that's one of the issues for me is genetics. I'm more predisposed to that high blood pressure. So do you see a large difference in patients that maybe have high blood pressure just due to weight, and then patients who have high blood pressure maybe because of a mix of both of those things, and watching the GLP-1 medication help their blood pressure regulate?
That's an excellent question. I'm sitting here thinking about my patient population. And I will admit, I'm drawing a blank on thinking of any examples that are more like you, where we did it for more of a blood pressure strategy. The vast majority of my patients have what we call comorbidities or multiple illnesses, multiple risk factors. So that's typically where that comes into play.
And I know when it comes to being on a GLP-1 and like, I know a lot of people talk about the issue of their insurance covering it.
Oh gosh.
The comorbidity part of your, being diagnosed with these handful of things and GLP-1s being a part of your treatment plan, that I think is a big tie-in to the insurance coverage of it all.
Absolutely. So sometimes those comorbidities help me in a way get those covered.
Yeah.
So I can't stand that cost is a barrier to patients. So I always work with mine the best we can to get things covered, get things as cheap as possible.
Absolutely.
So if we know about those comorbidities, I am listing every single one of them.
Yeah.
Just because that can help us. So if you are overweight and you have high blood pressure, sleep apnea is another one. Hyperlipidemia or high cholesterol, it will vary company to company, but those are some of the bigger risk factors or comorbidities that can help you get those medications covered.
Yeah, for sure. So something else I think is interesting, not only talking about, weight management and managing that cardiovascular health, but reducing inflammation. How do you see GLP-1s reducing inflammation in the body? Where is the tie-in and the correlation there?
Sure. We don't know.
Okay.
That's the fun part. These medicines, they're still relatively new. Trulicity admittedly came out while I was in medical school.
Yeah.
And I started medical school in 2013. So they are still relatively new.
Yeah.
So we're still working on their full impact, other illnesses we can use them for, and other benefits we might get out of these medicines as well.
Yeah. Okay. So something else I know that you're passionate about with GLP-1s is treating women who experience PCOS, polycystic ovarian syndrome. So tell me a little bit about that. How do you see your patients in office that do have PCOS and GLP-1s helping to treat that, which can be such a debilitating,
it really can,
disease for these women, whether, it's irregular cycles and they experience such pain, or, some people can't even get up and go to work one day because it's so bad. Or maybe it's they can't lose weight at all because, the hormones are out of whack. How do you see GLP-1s helping women with those?
So my biggest hope is that the GLP-1s get FDA approval for PCOS soon, because a big core of what we know about PCOS right now is that you have what's called insulin resistance, meaning your body just doesn't produce enough insulin to equate to your blood sugar and the rest of your body chemistry. So the GLP-1s can help bridge that gap. And when we have that hormone system back on board, it has a trickle-down effect.
Yeah.
So my women with PCOS, I've seen the facial hair improve. I've seen acne improve. They'll get the weight loss. And I've absolutely seen more regular cycles. I've seen improvement as far as like heavy flow, heavy cramps.
Yeah.
And admittedly, this is a fun one too. Once some of those women have regular cycles, then they can have kids.
Yeah. So I know there's a lot of women who have been on GLP-1s who think that they're next to infertile.
Yep.
And they get on the GLP-1, those hormones are regulating. Next thing you know, here they are.
Here's a baby.
And that might have been the answer to their prayer, to everything.
Certainly.
So I think it's great. And I know there's a lot of women that have experienced that. So
yes. And that's why that's my biggest hope, is that we do get approval and coverage for that for PCOS, because I think that is a huge subset of patients that could benefit from these so much.
So something else that I thought was interesting is talking about neurodegenerative diseases like Alzheimer's. And I know there's been some discussion about GLP-1s and possibly helping out with those sorts of diseases. So have you seen any of that in your practice, or, just in studies that have been coming forward with these medications about helping out with things like Alzheimer's? Sure.
So I personally have not read any of those studies. At least yet. I'm doing the best I can.
Yeah.
So I have not seen anything to do with anything as far as like Alzheimer's or dementia. However, there are a couple neurologic conditions that the GLP-1s can absolutely help. We do believe that the GLP-1As reduce your production of something called cerebrospinal fluid, or CSF for short.
Okay.
That's the fluid that's around your brain and your spinal cord.
Yeah.
Well, there are disorders where you produce too much of that, and that can cause headaches, blurry vision. You have issues walking, you get dizzy. I even have some that pass out.
Really?
So yeah, and those medicines will help decrease that production.
Okay. And what is there a age range that you see patients that have that overproduction of, what is it, CFS?
Sure. CSF.
CSF.
You got it.
So,
Sure, idiopathic intracranial hypertension is definitely a disease that's out there, and we are the target age range because we're younger, fertile women.
Okay.
And also, if you're overweight, that puts you at a higher risk as well. So, but admittedly, there are other similar illnesses that happen in my older patients where we get a similar thing.
Yeah.
And so I think it would be interesting to see what happens, but we have a ways to go with medical research.
For sure, of course. And I know there's lots of studies that are being done with these medications because there's so many people that have so many questions about,
Absolutely.
all the, not only side effects, but also these other issues that, that the medication seems to be treating in people, which is great.
Absolutely.
So something that I think is really important when we talk about these is not only what are they treating, but for patients that are trying to get some of these things under control, whether that's high blood pressure, whether it's just the need for weight loss, to be under a healthy BMI, things like PCOS, where, you have that insulin resistance and you have a hard time with losing weight because of that hormone imbalance. Something I think is really important to talk about, and you do a really great job of this, is that not only is the medication the only fix, but it has to become part of a larger lifestyle change.
Absolutely.
So I think a lot of people, when they hear about, it's a medication for losing weight, they think this is the miracle drug.
Yes.
And I'm going to take this pill or I'm going to take this shot and I'm going to lose this weight and I'll never be the same again. And I think that is a common misconception. And then if people come off the medication, they'll put that weight right back on. So how do you try to teach your patients and direct your patients into a larger lifestyle change so that this is more of a permanent solution to these things?
Absolutely. So one of the things, as you know, when I first talk to patients about potentially using these medicines, I always walk through side effects and I explain how the medicine works. Because one of the big things, you have to work with these medicines. Sure, if you don't work with it and you just take it, you might lose some weight and do okay. But as you said, as soon as you would stop that medicine, the weight comes right back.
Yeah.
Whereas if you work with the medicine, then when we stop the medicine, we stay healthy.
Yeah.
Ideally.
Yes.
Things can happen.
Fingers crossed.
Yeah. So it can help a lot. So certainly there are diet changes that are really important with these medicines. And that's a way to mitigate side effects as well. That's my personal approach.
Yeah.
So as you know, avoiding fatty, greasy foods is crucial.
Yeah.
Concentrated sugars, but you also have to maintain that water intake as well. If you don't do those things, your risk of side effects is much higher. And also if you are having side effects, try implementing some of those things and the side effects vanish sometimes, which is great.
For sure.
So,
well, I know, and a lot of people too, they get on this medication and their food noise decreases significantly. I know for myself, the first day that I took the medication, I always say, I was somebody who anxiety, I would eat, nervous, I would eat, upset, I would eat. And that was just how it was. Or I'd be sitting around and watching a TV show and, I need a snack while I'm sitting here.
Yep.
And your little snack or your popcorn turns into popcorn and candy.
Turns into a giant bucket.
Exactly.
And turns into a pizza.
And so I don't think people always understand food noise, but really food noise is just that little voice in the back of your head telling you, hey, it's time to eat. Hey, it's time to eat. And the first day I took the medication, the food noise totally gone, that silenced. And so I think that helps a lot when we talk about, it's satiating your hunger.
Yes.
For a lot of people that it wasn't that they really had the space in their stomach to keep eating. They might be thinking, I'm miserably full.
Absolutely.
But their brain is telling them, keep eating. And so people, take the medication, they have this food noise that's silenced, but then they say, I'm eating less, but I'll eat whatever I want.
Which is not helpful
which is
either.
not helpful either because it's not a part of that larger lifestyle change.
Correct.
And so I think for a lot of people, they see it as like the miracle of I can have all this greasy food. I can have all the fast food. I know people are like, I can drink whatever I want to drink. You know, people who used to drink alcohol and they'd feel gross. Now they're like, oh, I can drink whatever I want. And that's just not how it's meant to work.
No, it is
So
not.
it has to be paired with the healthier lifestyle changes of eating better and exercise. I think that's something that's very important because
It is.
am I correct with GLP-1? If you're not careful, you'll lose muscle mass, not just fat.
Oh, absolutely. And that's just not a careful thing. That's another thing I try to talk to my patients about because that's another reason you have to work with the medicine.
Absolutely.
We have seen there are studies out there that showed when we first started GLP-1A, rather than breaking down fat, your body's going to break down muscle. So one thing I try to talk to my patients about is make sure we're maintaining that protein intake.
Yep.
So, and you also want that intentional movement of exercise that helps preserve those muscles. Then you're getting the fat loss rather than the muscle loss.
Yeah, for sure. So tell me this in your practice, especially because, am I correct? So DOs really thrive, DO as opposed to MD. A big thing in your medical training is trying to do everything you can to keep from having to prescribe so much medication. If there's natural and remedies to certain diseases and illnesses, let's try those things first before medication. Am I correct?
Absolutely. That is a thing. Now, granted, some DOs are a little more of the traditional MD school of thought, but I am a quote unquote hardcore osteopath. So I look at the whole picture, and that's what I mean when I say I practice holistic medicine is I'm trying to look at the bigger picture. So yes, we want to lose weight. Let's look at your stress level. Let's look at your diet. How are you sleeping? Do we have metabolic issues? And also, how are we doing mentally?
Yeah.
Mental health is a huge thing with your overall health.
Yeah. So what do you see in your practice, knowing that, you know, you try to look at the whole patient, and of course, if we can keep from it, you know, keeping patients off of a whole slew of medication, what have you seen? What are the benefits of having a single medication that is treating a handful of issues at one time? I know for me, that one medication is treating a handful of issues all at one time. What does that mean for you as a doctor and prescribing medications to patients?
Yeah, that is one of the reasons I am such a big fan of the GLP-1As, admittedly, because I have so many patients that we've initiated that, and whether it's with weight loss or just with better controlled diabetes, I get to take away other diabetic medications. I get to take away blood pressure medicines.
Exactly.
One of the most fun things I can do is stop medicines
and
for people.
I feel like blood pressure medication is something a lot of people think like, oh, once I'm on a blood pressure medication, I'm never coming off.
For the rest of my life.
Exactly. And that's what a lot of people I think are scared of. If you're scared of taking medication, if you don't want to be on a lot of medication, to a lot of people that is a scary thing is, oh, I'm going to be on this medication forever. And that doesn't have to be the case necessarily. I mean, you know, if it's something that can be managed with your weight and, you know, we can start coming off of those medications is great. It's so exciting. I'm sure it's very exciting.
It's one of my favorite things to do in the practice, admittedly.
I'm sure.
I'll come out of rooms and I'll be like, we're stopping a blood pressure medicine.
Yeah, for sure.
So, because it's exciting. You know, my goal as a physician is to help people be healthy.
Yeah.
So, all my patients are adults. They make their own choices. I can only lead you in the right direction.
Yeah.
So I try to show ways with whether it's diet changes or lifestyle, that intentional movement of exercise. I try to walk people through ways that they can implement that in their life easier.
Yeah.
And that helps a lot with general health.
Yeah. So let me ask you this as well. So more invasive treatments. I know before I ever really heard people talking about GLP-1s, you know, you would hear about people having surgery that would help them with losing weight, whether that was bariatric surgery, you know, those sorts of treatments. What are your thoughts in practice? Have you seen a difference, or have you seen more of a lean towards, you know, if we can help a patient with a GLP-1 rather than undergoing a major surgery?
Absolutely.
What have you seen the benefits of that being?
So I do have plenty of patients that have gone ahead and had bariatric surgery. I still have some that are in the middle of the process. We're working on getting it for them. And sometimes that's because the GLP-1s are not affordable. That's where a lot of these come into play. But the weight loss surgeries also require lifestyle changes as well.
Yeah.
We have to be very diligent about certain vitamins in those patients that have had some sort of bariatric procedure done.
Yeah.
So I am also of the school of thought, the less invasive I have to be, the better off we are.
Absolutely.
So if I can just give you a once a week shot, or in Saxenda's case, it's a daily shot, and we avoid a major surgery with lifelong implications, that's pretty good. But bariatric surgery is still an option for a lot of patients, and sometimes it is the best choice.
Absolutely. And that's, again, something, they're your primary care providers, the only person who really can have that discussion
fully.
with you. So
Absolutely.
I just think it's great to have a non-invasive option,
Me too.
It's always scary to talk about a major surgery like that. And like you said, all these lifelong implications that come from those. So I just think that that's great. So I know we've talked a little bit about side effects, but I think a lot of people are scared of the side effects that do come with a GLP-1. That is what makes them nervous or apprehensive. And I know a lot of people who have tried one type of a GLP-1 medication and experienced a side effect, and then tried a different type of that medication and not had those side effects.
I have seen that a few times.
So do you know what would cause you to maybe experience a side effect like nausea with one medication? Maybe it's Ozempic or Mounjaro, and you switch to maybe the one or the other.
Trulicity or
Zepbound or Wegovy, and you don't experience those side effects. What would cause that difference in
that is an excellent question. So it boils down to just everybody has slightly different body chemistry. And so certain people will do well with certain medicines, like one brand over another. We do see that happen from time to time. Far to my knowledge, we don't have a way to predict that. So that's can be a little tough. But there are definitely people where they've just really struggled with Wegovy. And once I got them to Zepbound, they didn't have side effects and vice versa. So I've seen that happen quite a few different times, both on the diabetic and the weight loss end of things.
Yeah.
However, please always talk to your doctor if you're having side effects.
Of course. And so when you're prepping a patient who's going to be starting these medications, how do you go ahead and prepare those patients to kind of be ahead, if there's a way to be ahead of some of these side effects? I know people experience nausea, maybe constipation. What are the ways that you encourage those patients to be prepared and get ahead for some of those side effects if they're going to experience them?
Absolutely. So one thing I always talk to my patients about when I'm starting these GLP-1s, and I know I gave you this talk, is we have to stay hydrated. That is where we can avoid the vast majority of these side effects is if you keep up that water intake.
Absolutely.
Yeah. These medicines stimulate the pancreas, and the pancreas is a very picky organ that likes hydration, and it will make its presence known if you are not hydrated. So,
and it's so easy to not be hydrated.
It is.
I'm telling you, my Stanley Cup goes with me everywhere.
Listen,
it is an accessory, but I will tell you, and my pro tip is a cute cup or a cute water bottle, or for the men, something that makes you just feel special, will help.
Something fun.
Something fun. Yep. I have my cowgirl boot print water cup.
There you go.
And it helps me. I will say it helps me drink more water. So it is worth it. It's worth it to make the investment on your cute cup to help you with that water intake. But I know the water intake trickles down to a lot of those things with nausea and
vast
constipation.
It'll help with the constipation.
Yeah.
But it is to the point where I will tell patients, hey, if you're really concerned you're not drinking enough water, let's wait on starting this medicine for a couple weeks and get that hydration back on board.
Absolutely.
Thankfully, when I'm prescribing these, it's not necessarily a time of the essence situation.
Absolutely.
So we can afford to wait those couple weeks, get that hydration ready, and that's a way to prep your body for that medicine.
Yeah. So talking about that, one more thing I want to touch on is I think there's a lot of people who are maybe scared of a shot.
Oh, yeah.
So you have, your auto injector pens. You have, I know there's certain versions that people draw up themselves. Yes. And then there's pills. But I also have heard people more recently talking about microdosing a GLP-1. So can you just tell us a little bit about the difference in those forms of giving the medication?
Sure. So the approved method of administration is a subcutaneous injection, which involves a super tiny needle.
Yes.
Even those of us that are afraid of needles,
Are scared of needles.
like myself too.
Yep.
I'm in the same boat.
Me too.
It's manageable. So that helps. And it also helps a lot of times I'll walk patients through it in the office. And if the needle's still too much, we'll talk about other options.
Yeah.
Because that is a deterrent for plenty of people. However, it is a really, really tiny needle.
Yes.
And you don't really feel subcutaneous injection. So I try to talk to my patients and I'm like, you can just try it. I promise you'll be okay.
And so what about the microdosing? It's just something I've heard a lot recently, people talking about.
Sure. So that is an alternative approach to the weekly dosing that we're doing with the semaglutide and the tirzepatide. So I mentioned it briefly a little bit ago that Saxenda or liraglutide is a daily injection. Even though it's still a GLP-1A, it's a daily subcutaneous injection. So I believe that's the thought behind that.
And so it would just be a smaller amount
Yes.
of medication than what you would get in that weekly dosage.
Correct.
Okay. Gotcha. And then my last question about the actual medication itself is this a lifelong medication? I think a lot of people think you start taking it.
That is one of
on
the
it
more
forever.
common questions I get. Absolutely. So you do not have to be on these lifelong. If you make the lifestyle changes, a lot of times we can get you off of these medicines. Now, does that mean we just stop it cold turkey? No. Usually we'll look at weaning these off. I tailor all my GLP-1As to every single patient. That's how we avoid side effects, but that's also how we get lasting effects as well.
Absolutely.
So no, these do not need to be lifelong medicines at all. I tell people, even if we're just looking to lose 20 pounds, I'm like, hey, let's do this for like maybe 6 months and I think we'll be okay. And I've had plenty. I've stopped this medicine as well on plenty of people that have lost the weight and have a great lifestyle now.
That's great. That is great. So my last question to you would be,
Sure.
if you had to give a message to a new patient, someone who, came up on the street and asked you, what would you want patients to know about GLP-1s?
I think, truth be told, the biggest takeaway is talk to your primary doctor. Because ultimately, GLP-1As are not a good fit for everybody, too. Myself as a patient, I have a structural pancreas problem, so I can never take these because the risk of pancreatitis far outweighs the benefit from the medicine. So it's not necessarily a good fit for everybody.
Absolutely.
So I do encourage you to talk to your primary physician. You can also get a primary physician. Again, I'm at West Georgia Internal Medicine. I'm just messing. I am still accepting new patients. But talk to your primary doctor. They're going to be the one that can tell you if it's a good option. That's also who's going to be working with you as far as coverage, getting these medicines affordable if we can.
Absolutely.
That's where I always recommend starting.
Absolutely. And I think that's a great message. It's always talk to your primary care provider.
Always, please.
It's very important. Talk to your primary care provider.
We don't bite.
They don't bite. You can have a great old time. We have great old times during my appointment.
Exactly.
So, well, I think that's great. I think hopefully a lot of people took away some of these messages about GLP-1s. Hopefully this put a lot of people's mind at ease about what actually GLP-1s are and that they aren't just used for weight loss. They're used for a lot of other things as well.
Oh my gosh, yes.
And we're only going to learn more and be able to use these to treat, who knows, a whole slew of diseases and things that
hopefully,
we can get under wraps with these. So thank you so much for joining us, Dr. Cook. And
thank you for having me.
Absolutely. And thank you so much for tuning in to the Live Well Show. We'll see you next time.